signing the covenant made us really look at what we do, how we do it, what difference we can make. And I think signing that makes you look at your operation and what you can do better.
Embrace a Cultural Inclusion is a 5-year lottery-funded project, and the idea behind it was to engage older and old lesbian, gay, bisexual and trans people, specifically in Shropshire, Telford and Wrekin, to work collaboratively with organisations that provide health, social care and associated services to ensure that we could develop informed learning resources, really, so that the practitioners within those organisations could actually work more inclusively.
A range of health and social care providers and organisations providing services to older and old people across Shropshire, Telford and Wrekin are signed up to the Embrace Covenant. This is a commitment to follow 5 pledges and requires them to implement practical actions to ensure their organisations and the services they provide are inclusive of the lives, experiences and needs of LGBT+ people in later life. The 5 pledges. This short film highlights the key factors at play in this local initiative to embed inclusion into practice.
I think the most important thing about signing up to the Covenant is being aware of it in the first place. So understanding, what does that mean? What does that mean for the people that live in our homes? Because it is their home, and they, people in your own home, you must feel safe and secure and want to live the life that you want to live. I think that part of that Covenant for the team at Sand was about working in a person-centred approach, and the approach for learning has to be blended. So part of the Covenant within the action plan is to approach a blended learning approach, but adopting some of the Skills for Care framework too.
Over the lifetime of the project, Embrace has delivered a series of complementary components. Openly accessible awareness training which highlights why change is needed. The Covenant itself, providing an opportunity for service providers to make a public commitment and develop an action plan. The training of facilitators to increase capacity within the organisations to share learning. Support factors to maintain change, such as the ability to commission in-house training from SAND, a coordinated network of individuals trained as Embrace facilitators, and an online resource bank or publications and short films aligned to the Skills for Care learning framework, plus opportunities for individuals to join the Embrace campaign to promote change.
The original SAND training, we then, because that was so effective and so good and the people come away from that training, that was really good, I understand it a lot more. We then had SAND come in and do a training session with all our marketing at head office. And then we decided to put our training and registered care manager on the facilitator training.
From a personal level, it kind of opened my eyes to a lot of the challenges that people faced. I just feel like my eyes are a lot more opened, and I'm more comfortable in having conversations, and you do see that ripple effect amongst the team. You do see more open conversations had. You do see people more comfortable in talking about things that they might not have been so comfortable about. That includes myself as well.
It's a general awareness. It's okay to have conversations. It's okay that you don't know everything. And for me, it's about the support network that's available to people and what is out there to continue to support old and older LGBT individuals.
We've had 2 members of our team who've attended the Embrace Train the Trainer training, and that team have already delivered a kind of training session to our Shropshire, Telford and Wrekin volunteers. Now, I'm a regional manager, so I want to make sure that that training goes even further. So again, we pilot it locally, but actually if it's well received and increases the awareness of our volunteers, then I think it's something that I would want to roll out regionally as well. So, the work and the partnership with SAND has a positive impact for Shropshire, Telford and Wrekin, but for me, it's bigger than that. So there's a kind of national element to it and a regional element to it as well.
The last part of our action plan is how we roll that out to the organisation, what we do, what we put in place, having a voice from the organisation. So we have a diversity and inclusion steering group so that we can change things long term. So it's constantly being reviewed so that we can look at, we've achieved the steering group now, we've done the training, we've wrote all the policies. So our next step is for us to sit down and look at what we want to do next, where we want to change it, how we need to bring our franchise partners on board. During that training, one of our care professionals who has been with us for years told us she was gay in the training session because she felt comfortable in that environment. And the sad thing is she probably hadn't felt comfortable before. She felt that because we were listening to her voice and how she felt, and she could open up and say that at that session. And she hadn't felt like that before.
Ray actually decided that he would like to come out. He was gay, but he was more worried about the residents, more so than the staff, because we have a lot of staff with different preferred identities in the home.
I've worked in Shropshire for 10 years as a social worker now, and the fact that a lot of the LGBTQ plus community live with hidden lives has often been the complexity that we face. I've become involved with SAND because there was a gentleman that I was working with. He'd lived a hidden life for many, many years without any support networks around him, and actually needed that now because he was in crisis. Previously, they had shared with me as well that they'd had a list of at least 47 different providers and different professionals that they had involved, all with different names, each time a different contact. So they were having to share their story each time with a different person, which was impossible for them to navigate. So I think knowledge is power, and actually the problem is sometimes is people aren't aware of where to access support. So even if it's an organisation like SAND, having those points of contact for people to know to get from is often the really important thing.
Whenever you create a network, and I attend many network meetings in my role, you create a bunch of people who want the same outcomes and want to move and drive us forward. And I think for Shropshire particularly, the group that we've got in there, we are supporting older and older people in a very positive way, and also we've got hospice team members in there for the end of life. So for me, we will continue to network. I will continue to work with Sue and Sal in regards to the Skills for Care framework and moving forward, and also to ensure that we have a tiered approach to learning and that we continue to make our actions on our covenant come alive.
So I think the impact of people feeling able to be included as their own selves, and not having to identify as something else or mask, I think is invaluable. We see people thrive when that happens.
So we know that if people know where to go to get information, if they feel confident to ask for that information, if they feel confident to ask questions, then they get a better experience.
I suppose if there was a success about the training and moving forward, it would be that we were approached, and actually the gentleman did spend some time in one of our nursing homes by a gentleman who was married to his husband, and one of the reasons that he chose us for respite care, and it was respite care, was that he saw the signage and the posters, and actually it was a conversation that was discussed on assessment about his sexuality and sexuality care planning.
You can have as many systems as you want set up, you can have as many processes or leaflets or whatever, but it's people. So if you have the best leaflet ever for someone to look at, or organisation values and visions and principles set up, it's about how the people put that into place. So if you've not got someone who then is receptive or reflecting that approach and that vision, then it's worthless, because you've lost that person's trust again.
The management team, it starts at the top, and if the management team aren't prepared to change or prepared to implement something to make a difference to people, it has to be driven by somebody. And I feel quite passionate about this. I've got a training manager who feels really passionate about it, and a team that we can look at how we change it, what we do, and make a difference. And it does take a little while, and you do have to self-analyse how your company did it before, what we can make better. by doing this type of training or doing that can actually make a difference to one, all your care team, and two, to your professionals.
I think the Covenant has made us really analyse what should we be doing, a bit of our kind of gaps analysis. What are we not currently doing when we're trying to support our LGBTQ plus community, and have a staged approach to, you can't do everything at once. What are the kind of things that we should be doing within the first 2 years? So part of that is obviously training our team to be more sensitive and aware of the needs of our LGBTQ plus community, but also looking at our resources and looking at some of the service provision we currently provide, and should it be adapted.
And we know that it doesn't cost very much money, it doesn't take very much time, that after that initial investment, once we've embedded more inclusive practice into what we're doing, we naturally do it and people have a better experience. I don't get why anyone wouldn't do it, really.